Diagnosis according to Shi, Shui, Jin-Ye imbalances. Blood loss. Blood loss. This differentiation includes all forms of abnormal bleeding, whether it is from the nose, the gastrointestinal system, the urinary system, the respiratory system, or menorrhea. There are three main causes of bleeding. The walls of vessels are not strong enough to keep blood within the vessels, spleen, qi, shu. Blood is agitated and frenetic in its movement, so it ruptures the wall of the vessels, shi or shu heat. There is a blockage on the vessel, which results in a buildup of pressure in the vessel, which finally bursts, blood stagnation. Often, there will actually be a combination of two or more of these factors at the same time. There will be a difference in the quality, color, and amount of the blood that is lost depending on the cause. Bleeding usually leads to shui chu, and if the bleeding is internal, it will create blood stagnation in the local area. When there's blood loss, it is important not only treat the underlying pattern of imbalance that has led to the bleeding, but also to invigorate blood. This is because the bleeding will have created a local condition of blood stagnation. Furthermore, it is important to subsequently nourish blood in order to replenish the blood that has been lost. Symptoms and signs: bleeding and blood loss. When there is qi-shu bleeding and blood loss, the blood will be paler and more watery. There will be pale tongue and there will be a weak pulse. When there is a shi heat bleeding and blood loss, the blood will be fresh and red or bright red and possibly sticky. Heavy blood loss, red tongue, rapid and full pulse. When there is a shui heat bleeding, there will be bleeding and blood loss. The blood will be a fresh red color, low volume blood loss, red tongue without coating, and rapid and fine pulse. When there is blood stagnation bleeding and blood loss, the blood will be dark and probably clotted. There will be a low volume of blood loss. Blood will be dark purple and swollen sublingual veins. There will be choppy or confined pulse. The key symptoms of blood loss, the treatment principle is stop the bleeding. The acupuncture points to choose from are spleen 1, spleen 8, spleen 10, urinary bladder 17, liver 1, and kidney 8, as well as points relevant to the underlying pattern of imbalance. Needle technique, even technique. Moxa should be used on spleen 1 and liver 1. The explanation is spleen 1 and liver 1 are points that empirically can stop bleeding. Spleen 10 and urinary bladder 17 stop bleeding and invigorate blood. Spleen 8 and kidney 8 stop bleeding from the uterus. Relevant advice. This will depend on the underlying pattern of imbalance. Please see the relevant section for specific advice. It is important that a person who has suffered from bleeding make sure that they eat a diet that nourishes blood. Example, red meat, chicken, liver, green leafy vegetables, beetroot, seaweed, dates, nettles, aduki beans, kidney beans, and black beans. They should also eat a diet that tonifies spleen qi. Blood loss can be caused by the following patterns of imbalances: spleen qi shu, yin shu heat, shi heat, and blood stagnation. Blood loss can result in the following patterns of imbalance: shui shu, shui stagnation, yin shu, jin ye shu, qi shu. Thank you for your attention.